Are you concerned that back surgery may be in your future? I'm Dr. Rob Campbell, and I have a non-surgical solution that is safe and highly effective for the right candidate.
I have multiple herniated discs in my back and was a candidate for surgery. I didn't want to do that. After meeting Dr. Campbell, I'm now training for a full marathon. It changed my life.
Our unique method allows your herniated disc to self-repair without side effects. Avoid the injections and surgery. Call today for your no-charge appointment.
And with us today, once again, is Dr. Rob Campbell, known as the disc expert. Nice to have you here.
Good to be here.
And you've been on several times before, so it's great to have you. Today we're going to talk about the types of patients that you specialize in and a few other things as well, cortisone injections and things of that nature. So nice to have you here. I know you brought along a little model here that we'll get to in just a moment. So what are the type of patients that you specialize in?
Yeah, Ken, we specialize in really medical failures. And what I mean by that is people who have been through the medical route for their herniated disc condition. Mm-hmm. They've been to have injections or medications, or they're considering surgery, or they had surgery and it didn't work. People who are down the road on a herniated disc condition that everything they've tried, nothing has worked. Okay. And so those are the kind of patients that we specialize in. Okay.
And I know you've talked about that before, and you know, people go through a lot of different procedures to find out. Really, as you've said before, it's more about to find out about the pain and try and relieve the pain, but not necessarily what's causing that or fixing the underlying problem. So I've heard of the cortisone injections and why do people get those? And do they work? Are they safe?
Yeah.
And what exactly is it?
Yeah, that's it's something that I see in my office all the time, where people come in and they've been down the road as far as doing what has been recommended by their doctor, and it's a common standard of care procedure where they inject cortisone into the spine in an attempt to help to relieve pain. And it comes from the idea that people have this belief that pain is their problem. And actually, it's not the problem, it's the result of the problem.
Right.
So cortisone injections are very common. There's about 1 million of these done every year, annually in the United States. And the thing about the cortisone injection is that it doesn't actually do anything to heal the disc.
Okay. What does it do then? Just kind of relieve the pain? Is that exactly?
Funny you should ask, because I brought along a list here that I've put together that describes what happens during an epidural injection. And it's not a pretty sight here, but I'm just going to kind of go through this list here. The epidural injections are an invasive procedure. They can be painful. There are side effects, risky. Mm-hmm. Causes bone loss, causes damage to the blood vessels, causes weight gain, causes cataracts, causes autoimmune disorders, increased blood sugar, causes 21% increase in spinal fractures, possible bleeding, possible dural puncture, nerve damage. The list goes on. So there are risks, and what's interesting to me when people come in and they've had the injections, I ask them, did you read the waiver that you had to sign? And most people are like, no, I just signed it. Yeah. And there are dangers.
Okay. I could see why there would be. You brought along a couple different things today that we're going to talk about. You have a model here, and then this is a photo, actually X-rays, MRI, yeah, that shows the spinal cord and normal disc versus a herniation with some discs, right? And I'm going to hold this up, and it's a little bit easier. We're going to get it on camera over there. And why hold it up? You can talk about it.
Okay, so this is a great example because it shows, I've got my finger on the area where a disc is herniating. We've got the vertebra, and we've got the discs right in here, and back here is the spinal cord. And what we see on this is what a herniated disc actually looks like on an MRI. And there's a couple other things that are very important about this picture of an MRI is we can see that the other discs are a whitish color and it gets darker. And as it gets darker, that means it's lost its hydration. And this, another thing we can glean from this is that when people are told, well, it's your age, it's the normal aging process, that's the reason you have a herniated disc, and this MRI actually proves otherwise. Because if it were just age, Ken, then why are the other discs just fine and this one is bulging? And it's usually due to some type of trauma that happened earlier on in their life. But this is what happens to a disc. It bulges out, and this happens very slowly over years after a trauma, and when it happens, people aren't even aware that it's going on until finally it touches on that spinal cord and causes problems.
Okay, now you mentioned trauma. Can sometimes people get this without any trauma? Or is this usually the underlying cause?
Well, it's usually a single event or multiple events, and they can be so subtle that people aren't even aware of them because it doesn't necessarily linger on at that point, but years later it comes up.
Okay. So, if someone does suffer from this, and I imagine the pain can be anywhere subtle to almost unbearable, right?
Yeah, you know, and one unique thing about our treatment procedure, which deals directly with healing the disc and giving it what it needs, is that we don't have to wait for conditions to get so far down the road that they are immediately looking at surgery. If someone has a condition that is advanced to a certain point where the surgeon may say, well, you're not really ready for surgery, really they're just waiting for it to get to that point. We can help people at that stage also.
Okay. You brought this model in, and why don't you explain this? This shows how the discs work?
This is my favorite model because this is the low back.
Okay.
And we have the vertebra, and the discs are represented like sponges. And I love that because that's really what a disc is like, a sponge, where as we go through the normal motion of daily life, you can see these sponges are being moved back and forth, and that's how the disc gets its water, oxygen, and nutrients. When a trauma occurs, that ability to be more like a sponge disappears, and then it starts to collapse and then bulge. Okay, so these are the nerves that are coming out here that become irritated when the disc does bulge. That's my favorite model.
Okay, so what is the approach you use or the method of treatment, and how is it different from other standards of care or other types of things?
Yeah, Ken, the approach we use is very different. We educate our patients about the physiology of the disc and how it works, and no one is doing that out there. When we understand how something works, then we can understand how to fix it once it's broken.
Okay, and that's really the key, am I right? Now, as far as the treatments go, does it depend on the person as far as the length? Is it something that's always going to be ongoing?
Yeah.
Is it gets to the point where you can go, you know what, your disc is fine now?
That's a great question, and the reality is for most people, 85% of our patients who come in when they finish our program, which does take a period of a couple months, they're actually done. Their disc has healed, and the reason that works that way is because research tells us and shows us, and we've seen clinically, that the disc has the ability to self-repair, and that's what we tap into. Okay.
During that time, do they have to be careful of what they're doing? Just you say, well, you know what, maybe if you're going to go out and garden, don't bend over, don't pick up bags of soil or,
well, common sense plays a role,
okay.
But different than if someone were to have surgery where they would have to be extremely careful,
right.
Obviously immediately after the surgery. And then after the surgery, there is that, potentially 3 to 6 months of physical therapy to get back to a normal state, and hoping that there is nothing else going to be happening as far as a second surgery, which is realistic for some people. So no, it's common sense. They can go about their normal activity, and for some people who've had to restrict their activity, once they're done with our program, they can resume that.
Okay, last question. In this photo here, this MRI, we see maybe a couple discs. What's common? There's no common as far as someone comes in, do they have one disc that's having a problem? Do some people have maybe 6 or 7?
Yeah, every case is completely different.
Okay.
Just like everybody's symptoms are unique to that person.
Okay, so what you do, you can do all those discs at once if there's 3 or 4. They kind of, that's kind of what I'm asking. Or do you focus on one, get that one self-repaired and then go to the next
We
one?
focus on an area, and in
Okay.
most cases they're grouped, there may be
Okay.
2 or 3 in a row.
Okay, so that way, if someone's having a problem with 2 or 3 discs, you kind of,
Yeah, it's very common.
yeah, I would kind of think so, but I wasn't sure if some people come in and maybe they just have a slight problem,
we see
or I
that.
guess it's everything.
We see
yeah.
that, and the longer this condition has been going on, the more likely we're going to see multiple areas, and we do take care of that.
Okay, very good. Great information, and I want to give you Dr. Campbell's number. It is 949-702-4582. The website is easy, thediscexpert.com. Nice to see you again.
Very good, thank you.
All right, always good to have you here. And you may be a candidate, and as you said before, the first step is if they've already done an MRI, to bring that information to you. If not, that is something they need to do, because you need to get photos like this or pictures.
Right, Ken. And we do
Yeah.
offer a free consultation when they
Okay.
bring in their MRI, and we explain everything we do.
Fantastic. Good to see you.
Thank you.
All right, we'll be right back.
All right. Are you concerned that back surgery may be in your future? I'm Dr. Rob Campbell, and I have a non-surgical solution that is safe and highly effective for the right candidate.
It was amazing. I have now completed a 5K, and I just signed up to do a mud run in June, so I'm really excited. He's absolutely changed my quality of life.
Our unique method allows your herniated disc to self-repair without side effects. Avoid the injections and surgery. Call today for your no-charge appointment.